Well, the UK Health Security Agency says that it's working with Ealing Council's public health team to give advice to worried families in the area. They said they're monitoring the situation to prevent any further cases. Now, Strep A is a very common infection. Lots of you will have heard of it. It can lead to scarlet fever, which has to be treated with antibiotics. In very, very rare cases, it can get into the bloodstream and cause something called eye gas, which is what has very sadly led to these 6 deaths. There have been just over 100 cases of eye gas this year, which is more than usual. Health authorities say that parents and carers shouldn't panic, but that they should be aware of the symptoms. Today, a child in Ealing, West London, became the 6th to have died since September after developing an invasive form of Strep A, a highly contagious and usually mild bacterial infection that can cause scarlet fever. The UK Health Security Agency said parents should be aware of Strep A symptoms, which include a sore throat or a skin infection treatable with antibiotics. Strep A can also cause other conditions like scarlet fever, which carries symptoms like a sore throat, headache, fever and a pinkish or red rash with a sandpapery feel. Scarlet fever needs early treatment with antibiotics to reduce the risk of a more serious disease developing.
The parents shouldn't be overtly worried. The numbers of children overall with severe disease are small, and the overall number of fatalities, albeit everyone very sad indeed, are low. We just would ask parents to be aware of unusual presentations in their children and to go and seek medical attention where necessary.
7-year-old Hannah Roap from Penarth in Wales died last week. Her parents confirmed she'd caught Strep A and paid tribute to their daughter's beautiful soul.
Well, let's get more from our health and social care editor, Victoria MacDonald. Victoria, how worried should people be?
Well, all the experts are saying, the UK Health Security Agency as well, saying that parents really mustn't worry, but just must be alert for the symptoms that you just saw that Amelia laid out. But it is unusual to have such high numbers of cases right at this time of year. Normally it's something they might see in spring, following kids perhaps having chicken pox, their immune systems perhaps a little bit weakened. But this is in many ways a result of COVID, a result of the lockdowns, a result of social distancing. So children not actually having been exposed to Strep A, some of the younger ones, of course, never having seen it, although it is very common. Now, what is also happening is, of course, when you have this high number of cases, unusually at this time of year, you are also then going to get a higher number of the rarer form of the Strep A, the invasive group Strep A. And again, the health experts are saying this is what you would expect when you see those numbers going up, albeit it's very sad. The last time that we saw this number, well, it was in 2017-18, there were 4 deaths. What they are also saying is that what they want parents to be aware of is that there are high numbers of flu at the moment, and the rates of hospitalizations in the under 5s is climbing. So actually, while you're worrying about this, they don't worry about this. They want parents to be worrying about flu and go and get their children vaccinated.
Thanks, Victoria.